are switching to lower cost generic drugs rather than the items being prescribed by doctors. And you questioned whether the health of patients is being put at risk. And I think if I read you right, you were saying that people who are maybe less knowledgeable, less aware, are more easily switched for the advantage of the health plan and provider, not particularly for the advantage of the patient. Now, if I've misstated that, please state the case and make that argument if you would.
Well, let me begin and then begin with something else and then segue into that very quickly. What I'd like to begin with is kind of tying things together in regards to what has just been said. It seems that there is obviously a linkage between poverty and poor health care or substandard health care, and we must be very vigilant to make sure that we observe that linkage. I like to think of this as being a system of wealth care rather than health care. In other words, it's a matter of how much money you've got as to how good your treatment is, and that should not be in this country, in this democratic society. Now, that also ties in with what you indicated about this situation, which I call drug switching. Let me also begin by stating that the issue is not a matter of criticizing generic drugs. Generic drugs in many cases are very good medications. So I don't want anybody to think that I'm putting out a blanket criticism of the use of generic medications. What I do deplore is what is happening based on insurance company practices of switching patients or requiring the switching of patients from branded medications, which their doctors might have prescribed, to a generic drug which may not be an equivalent of the drug that the doctor intended the patient to have. And what that means is that someone other than a medically trained individual is making a decision as to how this patient is going to be treated, because the outcomes may be different depending on what kind of medication is given. And there are some specific instances of that. You don't have to just believe my criticism. There's been an outcry against this kind of practice, for instance, by the New York delegation to the American Medical Association, which called for the development of a code of conduct on the part of insurance companies, and is asking the full body of the American Medical Association to make a determination there. And further, there is a criticism of this practice of cost-based drug switching, which doctors in New York have stated have impacted their practice and are making worse medical outcomes in 92% of the patients that they treat. That's an enormous number. And I think it needs to be recognized that we need to do something about the insurance company practices, not only in regards to this situation about drug switching, but in regards to things like rescission of treatment of certain conditions and in their patients who are already insured. And certainly to make sure that insurance companies are more acceptable of insuring patients who don't have necessary financial means to pay for their medical care.
Thank you. Gentlemen, any comment or response? And let me ask Bill English to come up to the microphone as well. I got a question for you, Bill, in a couple of seconds here. Clarence Hightower?
Al, thanks. And I am particularly akin to the comment about the linkage that Dr. Williams just mentioned. It is a fact that those that are less off are oftentimes those that constitute the pool of those involved in the disparity. And that's the work of Bill and I. Our work is to lift those that are in poverty out of poverty. And as you begin to work to lift folks out of poverty, then you will also be lifting folks out of the mass array of disparities that we find ourselves caught in. And so I am appreciative of the fact that you brought, again, full circle, the notion of the linkage between those that are in poverty and those that have disparities.
Bill English is the co-chair of the Coalition of Black. Yes, go ahead, Dr. Christensen.
Because I'm going to have to, I will have to leave. If I could just say,
Please, go ahead.
This.
Yes.
We will be electing our new chair of the caucus this afternoon, and the likely person is Congresswoman Barbara Lee from Oakland. Mm-hmm. And
good choice.
We will have a poverty elimination agenda in the caucus.
Good.
And our whip, who is very close to our president-elect, is also very much an advocate for a poverty elimination agenda, and we are sure that he is going to make sure that the White House has a poverty elimination agenda. And I also want to say, just on behalf of the Congressional Black Caucus, that, thank you for having me as their representative here, and to assure you that whatever field, whatever committee or subcommittee all of us serve on, our goal is always elimination of disparity, whether it's economic disparity, job disparity, educational disparity, housing disparity. All of those things are part of the overall Congressional Black Caucus agenda, and so we do address health in a very holistic way as we come together caucus. But I want to thank all of the participants, and
thank you.
Dr. Williams, it's good to see you again. Thank you, Val. Go and we have a voting meeting going on right now, so I have to leave.
Thank you so much, Dr. Christensen. Let me have one question to close out on, and that's from, or comment from Bill English. Bill English is the co-chair of the Coalition of Black Churches and the African American Leadership Summit. And Bill, you and I have talked for years about the money side. We think it's important as business people to analyze problems and solutions in terms of the revenue streams associated with this. And it seems that there now is a great awareness of the opportunity to attack problems, and that involves deploying financial resources. How do we benefit? How do we align ourselves so that we not only deal with the misery, but also enjoy the resources that are used to eliminate misery?
Thank you, Al. First of all, it was very interesting. I mean, I've just
we've
been
got about 2 minutes.
amazed at the conversation here. And certainly that can't be done in 2 minutes, but I'll simply say this. That first of all, money is at the base, is at the bottom, at the underpinning of the healthcare problems in America. At one point, healthcare was a charitable thing in America. When money became, and look at the largest profit-making ventures in this country today is healthcare. And there's all kind of corruption and everything going on. So public policy has to address that. How you address it, that there are smarter people than me to do that. But I think there are a couple things that are important to say at the local level from a policy standpoint. First of all, it is interesting that the poverty rather than the middle class. Now, we're all excited about Obama, but the word poverty did not enter into this campaign. So I'm glad to hear the Congress say that. Now, I know he needed to say that to get elected, but we really have to deal with the issue of poverty in America as we address health care and everything else. The idea of empowerment zones is interesting, and both Clarence and Bill spoke to that. But you and I both know that the empowerment zone in Minneapolis was a disaster for black folk. It was built on our poverty, but the people who benefited were everyone, the developers, the Sears building, and everything else. So public policy has to be addressed in many ways in terms of making sure that there's equity in anything that comes out of this. And clearly, as we go forward, we have to pay attention. We have to pay attention by being vigilant, mobilizing, and using the court to address the issues of equity.
Thank you, Bill English. Well, we're at the end of the hour. It goes so quickly. Dr. Williams, thank you so much. Dr. Richard Allen Williams, joining us from Encino, California, the author of the book, the editor of the book, Eliminating Health Disparities in America Beyond the IOM Report. Dr. Williams, thank you so much for this conversation and for the work that you do. And let me thank the rest of my panel here.
It's been an honor and a pleasure.
Thank you. Mitchell Davis, Office of Minority Health here in Minnesota, Mr. William Davis, Executive Director of Community Action of Minneapolis, and Mr.